Hi, I would like to start my presentation off with a short story for you all to focus on. So, your 6-week-old child has stopped breathing. You rush her to the emergency room and learn she has a rare birth defect called tracheobronchomalacia, or TBM. This disease causes her windpipe to collapse and block airflow, but then the doctor tells you that he's able to put a splint in that will replicate your child's windpipe and keep it open until she outgrows the need for it, and the splint will be reabsorbed by her body. Although this sounds like something you might read out of a science fiction novel, the situation has actually already been done 3 times by doctors at the University of Michigan. The surgery they performed on this little girl would not be possible without the usage of 3D printing. But what exactly is 3D printing? How is it being used in the healthcare industry today? And what legal ramifications can occur from 3D printing of implanting medical devices or otherwise using 3D printed items in the delivery of healthcare? Hi, my name is Jessica Budai, and I chose to look into 3D printing of medical devices because of the story similar to the one I just told all of you. Throughout my presentation, I'll be diving into answering the 3 questions I have just asked. So, where it all began. Back in the late 1980s, Charles Hull, a graduate from the University of Colorado Boulder with a bachelor in engineering physics, was working at a company in California known as Ultraviolet Products. Hull was working on making plastic objects from a photopolymer for the company. When doing this, he developed a process for 3D printing. He left the company and then started his own company known as 3D Systems. So what exactly is 3D printing? A lot of us have heard about 3D printing, and maybe some of us have even had firsthand experience with it. 3D printing is a new, innovative way to create a product. It specifically is a process that creates a 3-dimensional object by building successive layers of raw materials. Each new layer is attached to the previous one until the object is complete. So objects are produced from a 3D digital file such as a CAD drawing or an MRI image. Because of the capabilities of 3D printing offers, this product has taken off in the medical industry, specifically in prosthetics, but over the past few years this has been expanding to other usages. So what is 3D printing in healthcare and the benefits it actually has to the patients? So 3D printing will impact healthcare in many ways, including implantable and non-implantable medical devices, as well as cost-effective customizable devices. Bioprinting is a very new and exciting prospect. In a radical way, 3D printing is shaping the medical industry. Bioprinting is the 3D printing of human tissue by depositioning cells layer over layer to grow organs. This makes it possible for a patient to receive the organ they need when they need it and customized specific to their body. Prosthetic limbs are now being made to mirror the exact size and shape of a patient's corresponding limb through 3D scan technology usage. How they do this is through taking the image of the sound side limb and laying it over the previous image to create a design, which is then loaded and transferred to the 3D printer to print a fitted limb to the patient in order to restore symmetry to the patient's body. As you can see in the picture of the little boy on the right, the functioning fingers aren't all there, but this prosthetic limb is fit to him and designed to read the electric currents from his brain to control the prosthetic hand. All this little boy has to do is think of his real hand exists, and the prosthetic limb will read this and perform the actions. This leads us to the opposite end of the spectrum, what the physician benefits are from this. So 3D printing has benefited physicians in a number of ways. The usage of patient-specific devices or devices with very complex internal structures has allowed physicians to reduce the surgery times, the costs, and then the risks associated with as well, thus improving the outcomes by decreasing the amount of impact they're causing to their patients. For example, if you look at the liver on the right, if a patient was in need of a liver and a physician has to use a standard medical device to replace their liver, they would have to restructure the veins and other connections from the patient's body to the new liver. However, with 3D printing, the physicians would be able to print a new liver with the exact dimensions to fit that person's body. Therefore, when they went to put the new liver in the patient's body, the amount of restructuring would be limited or non-existent, and all the physician would have to do is reattach the new liver to the previously existing structures. This leads us to exactly how 3D printing is evolving in the economy today. Due to the constant increased usage of 3D printing in the healthcare industry, as well as other industries, the 3D printing industry has expanded at an extremely rapid pace. As you can see in the graph on the right side of the page, a report by Market Data Forecast has reported that the global medical device 3D printing market was a $3.7 billion market in 2013, with a forecast to reach $12.8 billion by the end of the year and exceed $21 billion by 2020. This type of growth is significant and seldom occurs in many industries. There are only a few other industries that have actually experienced this level of growth in such a short period of time. And of course, no surprise, it's the smartphone and computer industry, with obviously Apple being the leader in these industries. As we dive directly into healthcare in the 3D printing industry, shown in the graph below, there's been an 80% increase in revenue between 2013 and 2014. This is a significant increase. It represents the number of physicians who are moving their practice to incorporate 3D printed devices. Not only does it represent physicians who are using this, it also represents the number of people who are looking to utilize the equipment when they are a patient in need, which ties into what companies are specifically using the boom of 3D printing. Stryker and both GE are two of the leading companies who have been affected by the growth in 3D printing industry. Stryker is a company who specializes in prosthetics and other medical devices, and over the past few years they've begun utilizing 3D printing to design and create a number of their products. GE has also reaped the benefits of this boom. GE created a brand extension called GE Additives that specifically focuses on designing and selling 3D printers. These two companies are two of the more renowned companies in the 3D printed industry, both having enormous contributions to the research and development of the ever-growing and evolving industry. There are also always going to be legal ramifications in any product. As we know, the possibility for some legal ramifications, 3D printing of implanted medical devices or otherwise using 3D printed items in the delivery of healthcare poses a more serious level of legal ramifications. Although 3D printing of medical devices has been approved by the FDA through the 510(k) clearance, under 510(k) clearance, basically an applicant must demonstrate that their device is at least as safe and effective. It has to be substantially equivalent to a legally marketed device. So basically, an applicant must compare their device with one or more commercial devices and provide data to support the claim of substantial equivalence. If the FDA agrees, then the product is cleared for commercial use. But still, there are ethical and more stringent legal ramifications that must be applied since human lives are being directly affected by these products. Intellectual property rights will be a huge topic that need to be taken into consideration. Counterfeit products may become a more pressing concern as healthcare providers and patients will now actually have the accessibility to create some of the medical equipment themselves. And then we also have to understand, who does the product liability fall under? Courts will have to take into consideration three separate factors. 1, who the owner of the printer is. 2, the manufacturing or supplier of the printer. And then 3, the person who created or used the untested product. And lastly, data protection will be a critical factor. The patient's drawings that are personalized to the bodies that are existent on CAD servers or MRI servers will be available to other users of the same server. Hospitals will need to determine if they require patients for a privacy consent to the 3D printing of their organs. And these are just some of the current initial issues being reviewed to date. So that brings us to the future of 3D printing in healthcare. Although the market is currently booming with the increased usage of customizable prosthetics and other devices, there are a number of scientists out there ambitious to find other use for 3D printing. Many areas across the world, researchers have also already been testing this technology through creating skin grafts, knee cartilage, and small heart valves. This is only the first step for where they plan to go. Scientists are saying they hope to be able to create human organs from a person's own cells. And they do this through what we discussed earlier called bioprinting. And the success of this development will have an enormous impact for the healthcare. It will help to reduce the significantly long transplant list, improve patients' chances of recovery, and they are now looking into the possibility of controlling or curing chronic diseases like diabetes. All of this is still in the beginning stages and has a lot of work left to be done. And current scientist BioZer, who is studying the usage of 3D printing for human organs, actually said, quote, "I expect this sector to hit the market in 10 to 20 years. and then the impact will be huge. This leaves us to debate these following questions. 1. Should hospitals require patients to sign a privacy consent to the 3D printing of their organs? 2. What happens to that 3D printed organ after the tested surgery? And 3. Is it ethical to recreate human organs? Thank you, and I appreciate your viewing.